Let's talk about this process called leukopoiesis. So remember, when we talk about this term in regards to all of your formed elements, we call it hematopoiesis. That just means the production of any of your formed elements. Remember, we call it erythropoiesis when we are specifically talking about red blood cells, and we call it leukopoiesis when we are specifically talking about the production of white blood cells. Now, there's actually two different types of chemicals that help to stimulate the production of white blood cells. One chemical is called interleukins. Now, we have lots of different interleukins. We give them names like IL for short, and then a number following that for the type of interleukin. And then we also have colony stimulating factors, or CSFs, and these are named for the type of white blood cell that they stimulate. So that makes it pretty easy. So for example, a granulocyte CSF will stimulate one of those granulocytes. Now remember, our granulocytes are neutrophils, eosinophils, and basophils. We also have a granulocyte CSF, and those will stimulate monocytes and lymphocytes. Now, a lot of times what we'll find is these colony stimulating factors, along with erythropoietin. Now, remember, erythropoietin is what is the hormone that is released by the kidneys that helps with the production of red blood cells. These can be used clinically to beef up your immune system in a patient who has a weakened immune system. So for example, someone who is getting ready to have a transplant, or someone who is HIV positive or has full-blown AIDS, or a chemotherapy patient. If for whatever reason their immune system is lowered, there are some things that medical doctors can administer to help beef up the immune response. Now, all of your white blood cells, all leukocytes, remember, they're all coming from your red bone marrow. All formed elements, red blood cells, white blood cells, and platelets come from that red bone marrow. And remember, the type of cell that is giving rise to your formed elements is a stem cell called a hematopoietic stem cell, or a hemocytoblast, means the same thing. Now, when we look at a hematopoietic stem cell, again, this is really broad. Now, a hematopoietic stem cell can be a little bit more specific. We can get more specific, and there are types called lymphoid stem cells. These will give rise to lymphocytes. That's one type of white blood cell. Or we have a myeloid stem cell, which will give rise to all of the other white blood cells. So that's going to be neutrophils, eosinophils, basophils, and monocytes, right? All of your granulocytes, neutrophil, eosinophil, and basophil, as well as monocytes. We produce 3 times more white blood cells than red blood cells. And part of that reasoning is because they do not live very long. They have a very short lifespan. They usually die fighting infections, whereas red blood cells live about 120 days. So they have a pretty long lifespan compared to our white blood cells. So we really have to pump out our white blood cells a little faster to make up for the ones that are dying. Now, this image here is showing you starting up at the very top with, oops, didn't mean to do that. Starting at the very top with our hematopoietic stem cell. Now remember, I told you this is very broad, very general type of stem cell, gives rise to any of our formed elements. Now, if that hematopoietic stem cell differentiates and becomes a myeloid stem cell, you can see here, it's going to give rise to your granulocytes and monocytes. So we can actually follow this down. So you can see it becomes committed, and you can see down here forms eosinophils. If it moves down this line, it forms basophils. Moves down this way, here's our neutrophils. So those are our granulocytes. And over here, you can see it forms a monocyte. On the other end, we have a hematopoietic stem cell that differentiates and becomes a lymphoid stem cell. This will give rise to your lymphocytes, T cells and B cells. Now, again, when we think of lymphocytes, in reality, this is what we truly are thinking of when we think of the immune system. We're thinking of our T cells and our B cells. B cells make antibodies, T cells fight infected body cells. These are really the power horses of your immune system. Now, the last couple things I want to mention in this little video are just some disorders that affect our white blood cells. So the first one that I have listed here is called leukopenia. Now, you're going to see that term a little bit more, not only throughout the semester, but throughout chapter 17. That term penia means poverty. So leukopenia is when you have a low white blood cell count. This is sometimes can happen with particular drugs or medications that someone might be on. Now, there is a disorder called infectious mononucleosis. A lot of times we'll just call it mono for short. I remember growing up, my mom called it the kissing disease. This is a very contagious viral disease that is caused by the Epstein-Barr virus. And when you are infected with this virus, it causes your body to produce a lot of agranulocytes, right? Monocytes and lymphocytes. The problem is they are atypical. So if you think about it, you might think, oh, well, you're making a lot of white blood cells. You're making a lot of lymphocytes. Those are good. Those fight infections. The problem is when they're atypical, they actually don't function. So you're making a lot of atypical lymphocytes and monocytes. They're not actually functioning to fight infection. They're just taking up space. And so the symptoms of mono are you are tired, you're achy, you have a really sore throat, and huge lymph nodes, right? Remember your lymphocytes, they live in your lymph nodes. This is typically where they're stationed. So your lymph nodes get really, really swollen when you have mono. Now, for most viral infections, there's nothing we can do for you. You just need to get a lot of rest, drink plenty of fluids, and it'll run its course. Your immune system will eventually start making antibodies. You'll mount an attack, you'll get rid of it. Now, with bacterial infections, we can give you antibiotics, but for a viral infection, there's really not much that we can do for you. Another disease of the white blood cells that I want to mention is leukemia. Leukemia is basically cancer of the white blood cells. Now, if we think about the term cancer, is just uncontrolled cell division. So this means that you are producing a tremendous number of abnormal, non-functioning white blood cells. Now, the problem with this is, remember, all of your formed elements, red blood cells, white blood cells, and platelets are formed in your red bone marrow. So if you're pumping out a ton of white blood cells, that means that it's crowding out your bone marrow and you're not able to produce your other formed elements. So you're not really producing enough red blood cells. You're not producing enough platelets. So someone who has leukemia a lot of times has early symptoms of anemia, hemophilia. They have problems with bleeding, and a lot of times they'll have bone pain because of all the excess white blood cells being produced in there. Now, acute leukemia, remember that term acute means sudden onset. So this is a quickly advancing form of leukemia, and it primarily affects children. Chronic leukemia, that term chronic means long lasting. This one usually affects the later cell stages, and we find it more prevalent in older individuals. So what do I mean here when I say that it derives from stem cells versus it affects these later stage cells? So let's skip back to this. So when we talk about leukemia, and we're talking about acute leukemia, something that affects children and it derives early on in this cell line, we're talking about here, it's affecting myeloid stem cells, lymphoid stem cells, as opposed to someone with chronic leukemia might be affecting some of these later cell stages, okay? Sometimes if it's left untreated, people can die from internal hemorrhaging. Again, if you're not making enough platelets, then you're not clotting your blood. And you don't realize how often you clot your blood. All these little teeny tiny microscopic capillaries in your body are very fragile and they break. So your body is constantly healing those and clotting your blood in areas where you need clotting. Overwhelming infections. Because you're not producing functioning white blood cells, you can't fight infections. You become immunocompromised. The treatment for leukemia typically is anti-leukemic drugs, radiation, and even stem cell transplants, where basically a bone marrow transplant. They wipe out your bone marrow and they give you donor bone marrow so that you are producing white blood cells that are functioning.